Hi everyone, I'm Dr. Jennifer Bryan, an emergency department physician at UHN. Today we're talking about MPOX, formerly known as monkeypox. With recent increases in MPOX cases across Canada, it's essential to understand how this virus spreads, its symptoms, and the importance of staying protected, especially if you're part of a high-risk group. Let's get into it. MPOX is caused by a pox virus closely related to the smallpox virus. The recent MPOX outbreak began in early 2022, with the first cases appearing in Europe and quickly spreading worldwide. This has included Canada, and since May 2022, we've seen over 1,700 cases across the country. For most people, the symptoms will resolve within 2 to 4 weeks. There have been no deaths in Canada due to MPOX, but there have been 48 hospitalizations. Due to a rapid response, cases dropped in 2023, with only 33 confirmed infections. However, we've seen an uptick, particularly in Ontario, where 234 cases were confirmed from January through October. MPOX symptoms can be a bit tricky because they can mimic other illnesses. Initially, people may experience fever, headache, muscle aches, and swollen lymph nodes, which are often early signs of the infection. In over 96% of cases, a rash typically appears, usually 1 to 3 days after the fever starts. This rash can be quite painful and tends to develop into fluid-filled sores or blisters, which then scab over before healing. The rash can appear on different areas of the body. It often, but not always, starts on the face, then spreads elsewhere, including hands, feet, inside the mouth, and the genital area. Sometimes the rash can begin even before the fever or other symptoms. If you experience these symptoms, it's important to get tested, as early detection can help prevent spreading it to others. If testing is required, your healthcare provider will collect a sample by using a swab to rub over any skin or mouth lesions for an accurate result. The swab will be sent to a laboratory where it will be tested for an MPOX diagnosis. Your healthcare provider will contact you if treatment is required. MPOX is primarily spread through direct, close contact with an infected person with a rash or open sores. This often includes intimate or sexual contact, but can also happen through prolonged face-to-face interactions, like sharing bedding or personal items with someone who has the virus. It can also be spread through coughing and sneezing, although this is more rare. It's important to know that MPOX doesn't discriminate. Anyone can get it. However, during the 2022-23 outbreak, MPOX disproportionately affected men who have sex with men, accounting for around 96% of cases in Canada. But let's remember, it's not confined to any one group. The virus can spread wherever there's close physical contact. An important part of Canada's response to MPOX is ensuring that high-risk individuals have access to vaccination. Thankfully, there are steps you can take to protect yourself, like receiving the MPOX vaccine developed specifically for the current strain of MPOX. In Canada, it is mainly offered for members of groups which have been most affected by MPOX. Check with your local public health office for more information. The vaccine is administered in 2 doses for full protection. However, in Ontario, only about 37% of people who receive their first dose have returned for the second. This is concerning because full protection is significantly improved with the second dose. If you haven't had both doses and may be eligible, reach out to your healthcare provider or local health clinic for guidance. In addition to vaccination, avoiding close contact with people showing symptoms and maintaining good hygiene and safer sex practices can also reduce your risk. It is generally a good idea to stay home if possible if you're sick and to wear a well-fitting mask around others. At UHN, we're actively contributing to the fight against MPOX. In collaboration with the University of Toronto and other Toronto area hospitals, UHN has launched a rapid research initiative aimed at deepening our understanding of the virus, including its symptoms, transmission, and genetic changes. This research is critical in developing effective public health strategies and improving care for those affected. While MPOX cases have increased recently, staying informed, taking precautions, and getting fully vaccinated remains your best protections. If you're at higher risk, reach out to your healthcare provider to discuss what's best for you. And as always, subscribe to UHN, Canada's #1 hospital, for the latest updates on health topics that matter to you. I'm Dr. Jennifer Bryan. Thanks for joining me today. Take care.